Hi, and welcome to Civic's Change Agent Chat. During these episodes, we will talk with change agents who are working to create a better health system for us all. I'm Stephanie Spriggs with the Center for Improving Value in Healthcare, or as we like to call it, Civic. In this chat, Civic's Cari Frank and Maria Diaz talk about the Shop for Care tool available on civic.org and how the procedures were chosen, what went into the analytics, and how change agents can use this information to access high-value care. We recorded this chat in April 2019. Thanks for listening and enjoy the chat.
Hi, Cari.
Hello.
Could you tell me about the new Shop for Care page and how this is different from information that Civic had released in the past?
Absolutely, no problem. Yes, we're very excited to have more information for consumers on our Shop for Care page, which you can access at civic.org and go to the Get Data tab. You can also link directly to it by going to civic.org/shop-for-care. And how it's different than the information that we've done in the past is this past July was the first time we really released imaging services that was primarily for MRIs and CT scans and a few other services like bone density and heart vessel scans. But this latest release that we just provided expands the number of imaging services to things like x-ray procedures for your wrists and arm and shoulders. And in addition, for the very first time, we're very excited to be able to provide what we call Prometheus episode services for common things like colonoscopies, knee and hip surgeries and births. And we're only one of 2 states in the nation that are providing episode-based pricing, which I know we're going to discuss in a minute here as well.
Yes, that sounds actually very interesting. How is that episode pricing different than other ways of providing price information?
Yeah, it's a really different way of looking at healthcare prices because typically it's very hard to understand what the total price of something like, for example, a knee replacement. If you've had knee surgery or know of someone who has, you know that you don't just walk in the door to a doctor's office and just have the surgery that day. There's a lot of things that have to take place beforehand and during and then after the surgery that all have price tags associated. So, you have to go to the doctor ahead of time and you get a pre-op exam that might include some MRIs or some analysis of what's going on. You have then also the scheduling any pre-op medications that you might have to take, and then the actual surgery itself, where you have a facility fee, you have usually an anesthesiologist, you have your surgeon, you have the actual charges that are related to the procedure itself, and then when you go home, you have medications you have to take, and then usually you have follow-up in instances like a significant knee replacement. You might have physical therapy and other things that happen after the fact. So, usually if you're a patient going through that, you might get multiple bills across all of those different care settings. But the Prometheus episode bundles that we've built that provide information on our website actually combines all of the prices and all of the payments that might be made on your behalf or between you and your insurance company. And then we provide that one full price of the episode all together. And that's really only possible with a claims data set like we are lucky to have in Colorado with the all-payer claims database, because we're able to build that episode across multiple different types of providers. It doesn't matter where you go to have your procedure, where you went before, where you went after. We're able to identify that entire bundle based on claims that are related to the care that you received. So I think it's really important to be able to understand from a planning perspective and as a patient, like how much will this actually cost me in total. So that's why we think it's really important to have that information out there for the first time in Colorado.
Yeah, that sounds actually very complete, because I've heard that many people always get confused about receiving multiple bills about one thing, and it's like you really don't know how much is going to be in total. And it seems like these prices actually cover all those different things that you're gonna have to pay.
Exactly.
For one
Yeah. I think that, yeah, you're right. As a patient, it's probably really frustrating to keep receiving bills, and you're like, when are they going to end, and what is my total price going to be?
And how do you think this information can be used by people, by patients, regular consumers?
Yeah, I mean, I think, again, it's important that for planning purposes and for shopping, too, because what we see when you look at the full episode price, variation is significant across these different procedures. You can pay thousands and thousands of dollars more by making a decision to go to one facility versus another. So I think as patients, we need to understand that we have a role to play in reducing healthcare costs, and the decisions that we make to go to a high-value provider that has good quality and a reasonable price, you know, that can actually impact our pocketbooks ourselves, but then in the future too, because we're making smart decisions that are lowering healthcare in general.
So are you saying that even if I don't have to pay out of pocket, or if I have to pay just a little bit out of pocket, it is important that I shop for Cari?
Absolutely, and I think that it's a change in the way that consumers think. I mean, a lot of us, even if we happen to have a low deductible plan, which I think are pretty few and far between, unfortunately, most people are starting to feel the effects of having high deductible plans because rates just keep going up. But even if you do have a low deductible plan and you pay $150 out of pocket regardless, that can impact your premiums in later years if you're deciding to go to a really expensive place for your care, because that gets factored into how premiums are set in the future. So even if you are lucky enough, like I said, to have a low deductible plan, you really should be thinking about where you're going and be a good healthcare consumer and be conscientious of the total price. We recommend that you go to our website, because obviously that total price isn't reflective of what you might actually pay, but it will help you understand, okay, maybe I want to look at these 5 facilities because they look like they have really great quality and they have a good price. And then we recommend, if you have insurance, go to your health insurance company and say, how much would it be for me out of pocket based on where you are with your copay deductible and your specific plan design. And then if you don't have insurance, we also think that that's a great way for you to negotiate with facilities. You can go to a facility and say, you know, it looks like your median or average price is, you know, $2,000 for this particular procedure. Then you can start negotiating on the self-pay basis as well.
So, yeah, that sounds very important, and it seems like we all have a role on making our healthcare costs lower. But besides the regular user who's like looking to get a procedure done, who else can use this website and this information?
Yeah, I think there are a lot of different stakeholders, as we call them in healthcare. Really, we all, even consumers within their policymakers, looking at ways that we can reduce healthcare costs. Providers themselves are, for the first time, seeing this information. They don't know how their payments relate to, you know, the healthcare provider down the street, and they want to be competitive in the market. So I think providers can use this information to make sure they don't want to be the highest, you know, priced facility. And so when we've been meeting with the hospitals and other healthcare providers, the ambulatory surgery centers, they're all very excited to see where they sit in the marketplace for the first time, and so they can use this information. I think health insurers can also look at this information and see the variation and make adjustments on their business model. And then also, I think an important stakeholder that we haven't really talked about in much detail today is the employer, self-insured employers. So employers who are actually providing their own insurance out of their pocket, they can change their benefit designs based on the information that is available and actually steer their employees towards high-value care. And we've seen in other states that have done analysis of data like this that's available to consumers, one of the biggest bangs for the buck, so to speak, as far as really moving the needle in healthcare costs is when employers say, okay, if you want to go to a very expensive facility that might not give you the best outcomes, that's fine, but you're going to pay more out of pocket. Or on the flip side, they could steer people to the high value healthcare facilities and say, if you choose one of these high value facilities, then we're going to waive your copay altogether. And so that actually helps consumers make better decisions too, and it is directly impacting their pocketbook. So in states like California who have done analysis on data like this, really see a big shift in prices when they look at employers changing benefit design.
Oh, thank you. And I was looking at the website and I see that you have the price listed and then you have a patient experience or patient quality measure. Why is that important and how should we look at that information?
Yeah, I mean, I think as consumers, we're used to having some sort of, price is only one thing that we look at. We might be looking for a good restaurant. We're going to look at how many stars does it get, because just having a cheap restaurant isn't indicative of whether we're going to enjoy it or have a good meal. So similarly with healthcare, we want to make sure that people are thinking, cost is obviously very important, but the quality of the care that you receive is also just as important of a consideration. And we want to make sure that patients have that information to see both side by side. So what we provide on the website is information that the cumulative patient experience quality measure that's available publicly from the Center for Medicare and Medicaid Services. And it again looks at multiple different questions that patients are asked on the survey. Things like, were you given good instructions when you left the hospital, and did you understand what kind of medications you're supposed to be taking? Did the nurses and the doctors communicate well with you while you were at the facility? And then I think a really important piece is also, would you recommend that facility? Because if you're a patient looking to find a good place to go, you want to know would other patients recommend this facility. So that's the information that we're providing right now on the quality side. And in the future, we plan to expand that. Right now, we only have information for hospitals on quality because that's what's available publicly, but we want to work with the ambulatory surgery centers and other facility types to also add patient experience for those facilities as well.
And now that you're mentioning about the future, do you have any other plans on releasing more cost information?
Yeah. Well, I think that what we have right now, we're going to be expanding that information to just look at it differently. So right now you can shop based on each particular facility, and you can do that by zip code and look at the distance from your zip code. But then we're also going to be breaking down that episode and helping people understand, like, of that full episode price, what percent is usually attributed to the facility, to pharmacy, and some of those other categories of payments that are included in that full episode. And then we're also going to be breaking down the cost so that you can see variation in the cost across Colorado on the Division of Insurance region basis. So if you look at that information, you can see there's a lot of variation in the facilities, but then when we roll that up even higher level at this geographic region, we see variation as well. So we're going to be providing that data in the future. And then we're going to also add more services as time goes on. So things like dental and office visits, and then also more episodes that are high volume across the state, like newborn care and hysterectomies will be added so that there are more and more services people can shop for. And we also would love to take recommendations too. If anybody has any recommendations on things that you would like to see from a facility price and quality standpoint, we would love that feedback, and you can reach us at any time at info@CIVHC.org at any time. And then we also have other information publicly available on on cost in general across the state of Colorado, utilization, chronic conditions, and quality of care too. So we're always continually updating our public reporting and adding more and more years of service as we have more claims in the database that we can update information and look at trends. And but yeah, we would love to have input from anyone who has suggestions out there.
Well, that's all the questions I have at the moment. Thank you, Cari, for all that great information, and hopefully many people come and use the website.
Absolutely.
And ask questions and make suggestions also.
Absolutely. Thank you for having me today.